Happy New Year. I'm Dr. T. Tanya Armstrong, licensed psychologist, owner and CEO of the Armstrong Center for Hope, a psychological and spiritual wellness center for all ages, and the author of Blossoming Hope, the Black Christian Woman's Guide to Mental Health and Wellness. Today, I wanted to talk about something that is very important to our ability to thrive in the new year. We are looking forward to many great things happening in 2022, but we have to acknowledge as 2021 has now come to a close that there are some challenges that we've dealt with, some of which are very related to the coronavirus and the Delta variant and Omicron and others that may yet be to come. But others of them have been longer standing challenges that we've had. So I want to talk about those items today, and I want to talk about a very important thing to do for the new year, which is connecting to a good therapist. On this first day of 2022, I hope that you had a chance during the holidays for renewal, for refreshment and rest, and that you are now ready for 2022 with great vigor. I hope that in your downtime, you've had a chance to do some reflection and some contemplation. Those are terms that we use simply to talk about the importance of gathering our thoughts, looking back at our past, and figuring out a way to move forward in greater strength and success for 2022. So perhaps you're someone who likes to set new goals for this time of year. Sometimes people use the language of New Year's resolutions. Other people like to think more in terms of setting an intention for the year ahead. So, whichever language you use, I want to talk today specifically about setting an intention to connect or to continue with a good therapist. Now, you may ask, why would I want to connect with a therapist? But I suspect that during these years now of COVID that we have suffered, that we've had much time to think and to reflect about where we are, where we've been, and most importantly, where we'd like to be. So, as you've thought about some of these issues, you may have done so in the context of ways and thinking about ways that COVID has changed your life. Perhaps you're someone who has seen some changes in the way that you conduct your work. If you're still in the workforce or have yet to enter the workforce even, you may have been thinking about the things that you do and the things that you want to change for the future. Some of those changes have been ones that have been passed on to us as a result of circumstances. So, for example, some of us may have had changes in our employment status, perhaps changes that were unwanted. We may have been laid off from a job, or we may have been involved in the kind of essential work that has been exhausting to us. Or maybe we've had an opportunity to participate in what's called the Great Migration, where we've actually ended up leaving a certain job and looking for better, greater, or more enjoyable, more passion or purpose focused in pursuing our vision. And so, for these reasons, we can find that psychotherapy can be a really sound way of getting in touch with ourselves and making sure that our minds are ready to grasp the profound things that God wants to do for us in the new year. For others of us, we may have dealt with situations during COVID that might have been worsened, or maybe new encounters for the first time with feelings of depression or anxiety, feelings of isolation. And certainly many of us have gone through issues around grief and loss. COVID has led many of our family members, our loved ones, maybe even ourselves, to go through times of suffering and perhaps even loss through death. And so often it is difficult to find a way through grief. We thank God for supporters, we thank God for the Holy Spirit, and we thank God that there are therapists available to help us with making the journey through grief. So that may be another reason that one might look for a psychotherapist. And I did just want to mention that when I use the term psychotherapist, I'm really speaking to a host of different types of licensed mental health professionals that are gifts to our world. So, for example, I'm a licensed psychologist, but there are also in our state of North Carolina, for example, we have licensed psychological associates with master's degrees in psychology. We have marriage and family therapists. We have licensed clinical social workers and also licensed clinical mental health counselors. And so those are all persons that fall under the umbrella of offering psychotherapy and counseling. We also have, if it be the case that you may need medication for your challenges, you would seek a psychiatrist or perhaps a psychiatric nurse practitioner or some other prescriber who would be familiar with your condition and able to both evaluate you and manage your medication in an effective manner. So, those are all the types of persons that I'm referring to today. And oftentimes it takes us a while, especially in the African American community, to come to a decision that we're ready to do the work of psychotherapy. Psychotherapy, in my experience, having been licensed in clinical psychology for over 20 years, psychotherapy is more than just a treating acute symptoms. Maybe we've had an experience of panic attacks. Maybe we've had feelings of depression that have turned out to be more than just the blues or sadness that everyone goes through. So we've come to this decision perhaps slowly. But once we come to the decision, then what? How do we connect with someone who is really going to speak to us in a way that is both resonant with where we are in life, but also helping to support the transformation that we seek? So I have a few tips for you as you embark upon this new year to help you find a good therapist. One of the first things that I would recommend to you is figuring out, what are some good resources that are available in my area? For some of us, it may be important to locate someone who is geographically close to us, and we don't know when the coronavirus is going to dissipate. But we do anticipate at some point that it may be important for us to connect with someone that we can visit with face to face. One of the things that we can do if we desire to work with someone who is close to us geographically is we can talk to our friends. We can find out if there is anyone that they would refer. And even though there's still quite a bit of stigma that is associated with seeking a psychotherapist or a counselor, you may find that you might be surprised at how many of your friends, loved ones, your associates from work, and so forth may have already embarked upon that path and would readily give you some recommendations or some referrals. So that is one of the first steps that I would recommend for you. A second step that I would recommend is looking for someone using internet searches. In my book, Blossoming Hope, I mention in one of the appendices several of the locations that you could search for on the internet in order to find a suitable fit for you. One of the ones that I recommend is Psychology Today, and that will give you an opportunity to both search for someone who is geographically close to you, but also someone who perhaps shares certain affinities with you. So perhaps you prefer a Black female, for example, or perhaps you desire a marriage and family therapist or someone who is in your particular zip code. There are multiple filters within Psychology Today that will allow you to identify someone or a number of persons who fit those criteria. Another resource that I would recommend is AfricanAmericanTherapists.com, as well as TherapyForBlackGirls.com. These are especially helpful resources if you are seeking someone who shares your cultural affinities and may be able to better understand your life situation. So these are some resources that you could select whether you're seeking someone who's geographically close to you or if you're seeking telehealth. Telehealth is a format that has actually been available for many years, but many people have discovered how convenient and effective it can be during COVID. So I would recommend you to even consider working with someone on a very secure and what we would call HIPAA compliant platform. And there are many persons who are available to you through the telehealth format. So I encourage you to consider those resources as well. After you've done your research and you've identified some persons who may serve as good candidates for your next therapist, I would encourage you to ensure that they are licensed and or certified. And so what you would do is to go to that person's respective board in their state. For example, I am licensed in the state of North Carolina as a psychologist, and so you would go to the North Carolina Psychology Board and look for something like license verification. So you would type in the person's name to ensure that their license is active. After you've verified that the persons that you're interested in working with are licensed, the next thing that you would do is to begin to make some phone calls or send some emails. During this time of COVID, many therapists have made themselves available in several ways. Some of them will offer consultations available to you to get a better sense of the fit. So there are some people who would be available on their websites to click and make an appointment for a free consultation. Others will charge for that consultation. And others will rely on you to read their bios and look at their website to see if that may be a good fit for you. In many cases, if you call their office, you may find that there is either a confidential answering service or greeting that will allow you to leave a confidential message. In other cases, you may find that the office has someone who will take your call as it comes in. Often, when we are conducting therapy, we are not available to come to the phone, as you can imagine. And so, don't necessarily be put off if you find that someone is not answering phone calls. It's also important to note that during this period of COVID, that many of my fellow mental health professionals are full. And I don't want to discourage you if you've made up your mind that you'd like to connect with a psychotherapist or counselor. However, I do want you to be aware of the fact that there may be a wait, and particularly at this time of the year, when others are also interested in securing a great therapist, that you may find that there is a period of time that you have to wait before an appointment is made available. But if you've done your research up to this point and you feel pretty confident that that would be a good match, or that you've narrowed it down to maybe your top 2 or 3, then you do want to be patient in allowing that person to schedule a time with you. Another really important consideration for committing to this journey of transformation through therapy is to ensure that it is something you will be able to afford over the long haul. Many of you may have healthcare insurance that will cover the cost of much of your therapy. Typically, there is either a copay and or a co-insurance that you'll be responsible for. And sometimes, especially at the beginning of the year, there's also a deductible that must be met before your insurance will begin to cover the cost of your services. So you do want to check with your insurance company and find out what your responsibility will be. You also want to ensure that the person or persons that you have in mind accept insurance. Some do and some don't, so you want to do your due diligence there. You'll also find that for anyone who perhaps does not accept insurance and may be out of network, that they may either file your insurance for you or provide you with what we call a super bill that gives all of the necessary information, including the company's tax ID number. It may include your diagnostic code, as well as the type of procedure or service that was provided. And all of that information is provided to you so that you can recoup your funds after you've paid your therapist. And so these are things that you want to make sure that you're aware of before you make the commitment to therapy. It is sometimes difficult to determine how long therapy will take, but I do encourage you to at least consider that when you are thinking about many years of life that you may be reflecting upon in your therapeutic path, that it's reasonable to consider it may be at least 8 to 12 weeks on your journey, depending on the goals that you develop with your therapist, and sometimes a bit longer to really work through, for example, some more complex issues, perhaps family issues, relationship issues, or issues around trauma. So do be aware that the therapeutic journey can take some time to get to the outcome that you desire. So I hope it has been helpful for me to outline for you a few of these steps that you can take toward finding a great fit with your therapist. And so I leave you today with a song. One of the things that, as you may know about me, if you have checked out my website, which is drtanyaarmstrong.com, you can see that in addition to being a psychologist and author, that I'm also a vocalist. I have a couple of albums out, one of which is connected to Blossoming Hope. It's entitled Blossoming Hope Companion, and you can download the free audio files by visiting my website, again, drtanyaarmstrong.com, Blossoming Hope Companion. And so once you listen to that, you will find that there are several tools are available, specifically my 111 Blossoming Hope tools to accompany you on your journey for 2022. So because it's something that I like to do, I am going to leave you with a song today. This is a song that I believe embodies the hope that we have for the new year. And it's also my special message to you that I hope you'll be tuning into my channel over the next several months and that we'll have a journey together toward hope. So this song is a song from Kirk Franklin and the Family entitled Till We Meet Again. May his peace be with you till we meet again. May his peace be with you till we meet again. Till we walk the distant shores and we'll shed a tear no more. May he give you strength to endure till we meet again. Till we meet again. May his peace be with you till we meet again. May his peace be with you till we meet again. Till we walk the distant shores and we'll shed a tear no more. May he give you strength to endure till we meet again. Till we meet again. Thank you for tuning in today. If you liked this video, I'd value your like down below. If you have a comment, please engage me there as well. And better yet, if you'd like to subscribe to my channel, I look forward to many other times of teaching you more about Black mental health. Till we meet again, have a great 2022. Bye-bye.